Hello, welcome to part 35 of Clinical Physiotherapy MCQ series. Here, we'll be discussing day-to-day clinical scenarios with detailed explanation. Now let's move to question number 171. What is the term for pain and disability of wrist and hand secondary to impingement of the median nerve? Option A, Carpal bow syndrome. Option B, radio ulnar syndrome. Option C, carpopedal spasm. Option D, carpal tunnel syndrome. And answer is Option D, carpal tunnel syndrome. Explanation to this question is carpal tunnel syndrome is a medical condition due to compression of median nerve. A sit travels through the wrist at the carpal tunnel. It is a common condition that causes pain, numbness and tingling in the hand and arm. Now let's move to question number 172. The therapist routinely places ice on the ankle of the patient with acute ankle sprain. Ice application has many therapeutic benefits. Which of the following is body's first response to application of the ice? Option A, vasoconstriction of the local vessels. Option B, decreased nerve conduction velocity. Option C, decreased local sensitivity. Option D, all occurs simultaneously. And answer is Option A, vasoconstriction of local vessels. Explanation to this question is local vasoconstriction is the first response. Nerve conduction velocity decreases approximately 5 minutes of the ice application. Now let's move to question number 173. Tibial rotation knee motion is possible when the knee is positioned in 90 degree or more of the flexion because in this position the Option A, condyles of femur glide posteriorly on the condyle of the tibia. Option B, hamstring act as the rotating force. Option C, patella derivates inferiorly. Option D, tension of the ligaments is decreased. And the answer is Option D, tension of the ligaments is decreased. Explanation to this question is when the knee is extended, the medial and the lateral collateral ligaments are taut. During the knee flexion, the ligaments slacken. Therefore, there is very little tibial rotation when the knee is extended, that's close back position, and approximately 40 degree of axial rotation with the knee flexed. Although the femoral condyle may glide posteriorly, depending on the direction of the rotation, on the tibia and the hamstring may rotate the tibia. The reason of the motion is available due to laxity in the collateral ligaments. Other ligaments such as cruciate and the joint capsule may add to the stability in close back position. Now let's move to question number 174. To strengthen your patient's levator scapulae muscle, you would ask your patients to perform 10 pain-free reps of resisted scapular dash. Option A, protraction. Option B, adduction. Option C, elevation. Option D, depression. And the answer is Option C, elevation. Explanation to this question is strengthening exercises for levator scapulae involve particular joint movements that activate the muscle. The three movements most often utilized are scapular elevation, cervical spine extension, and lateral flexion of the cervical spine. Now let's move to question number 175. A 79-year-old female patient presents to outpatient rehabilitation service 6 weeks following a CVA with right hemiplegia. She complains of right shoulder pain working on the functional upper extremity movements and has severe shoulder pain when practicing bed mobility activities such as rolling and scooting. On examination, it is observed that the humeral head is inferiorly displaced. Which of the following would be the most appropriate for her condition? Option A, transcutaneous electrical nerve stimulation. Option B, functional electrical stimulation. Option C, SWD, that's short wave diathermy. Option D, interferential current stimulation. And the answer is Option B, functional electrical stimulation, that's FES. Explanation to this question is FES is the correct answer. Using FES to help elevate her shoulder will treat the displacement and ideally eliminate the source of the pain. Option A, TENS is powerful modality that will treat the pain in many individuals. This woman does complain of pain, but the impairment of the inferiorly displaced humeral head is also mentioned. TENS will have little effect on this displacement. Option C, SWD, is pain relief modality that is not often used. Option D, IFC, is another form of TENS and will not help much with the displaced humeral head. So that's all for today. If you have any doubts, please mention in the comment box. For further learning, keep in touch with the channel. See you in the next part, that's part 36. See you, bye bye, thank you.